private practice. Yes, I accept that it's hard getting to the top of the ladder. So why don't we have a system in which the really superior doctors pay double the rest? And who will decide this? You'll decide it, not me. You are the professional people who can judge who is good.
With time running out, all Bevan's hopes for launching on July the 5th now rested with Moran. But there was a problem. Moran was up for re-election. His position as head of the Royal College faced an imminent challenge. It came from Lord Horder, the King's personal physician, and one of the most die-hard and outspoken opponents of Bevan's National Health Service.
Lord Horder came out with a declaration that the idea of a National Health Service that Bevan was proposing was, as he put it, the mad march to totalitarianism. And this was the attitude. Horder was an extremist, of course, but he also represented a very large slice of the medical elite.
It came to a head in the annual election for the presidency, which took place once a year with probably about 300 fellows attending. And he regularly stood against my father, and for about 9 times running, I think.
Moran routinely defeated Horder by a majority of 10-1. But in 1948, with Horder campaigning on an anti-NHS ticket, this vote would determine not just the presidency, but the very survival of the NHS.
To elect the president, you had to go to their college building in London.
The place was packed. Every possible person came. And there was a very, very tense and dramatic election.
You then cast a piece of silver for the candidate you wished for.
The registrar read them all out one by one.
Moran, Horder. Moran, Horder.
It was very tense. Everybody was on the edge of their chairs watching what was going to happen. And there was a moment when there were 5 Horder votes in a row.
Horder, 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 Horder.
Really looked as though that was it and Horder was going to make it.
Horder.
It was absolutely touch and go.
The final vote was 165 to Horder and 170 to Moran. The future of the NHS had turned on 5 consultants' votes. Moran would now lead them into the health service.
The amazing thing was that Bevan turned out to be somebody with whom you could do business. He actually listened. People went into the room with Bevan thinking that he was going to be a rough, tough street fighter and below the salt. They found this pleasant, charming man who could whistle the birds down from the trees, who listened, who would in fact accommodate you whenever possible.
But what about the GPs? Moran now wrote to Bevan with an audacious suggestion of his own.
My dear Nye, the irrational fears of the GPs that they will become slaves is based on their fear that one day you will turn them into full-time salaried servants of the state. You could eliminate
to get the GPs on board, Bevan should amend the NHS Act to guarantee he would never reduce them to civil servants or wage slaves without launching an entirely new Act of Parliament.
I would, of course, support you in the House of Lords.
2 days later, on the 7th of April, Bevan made this amendment in the Commons. Moran applauded him in the Lords. Their deal was finally sealed. Bevan's sudden political compromise should have been welcome news to the doctors and the BMA, but far from caving in, they simply dug their heels in further. With a fighting fund in place, now they were threatening to strike rather than sign up to the NHS. Facing continued resistance, Bevan kept his cool. He ignored their threats and announced louder than ever that his health service would start, as promised, in 3 months' time. Even though not one doctor was on board, a massive public information campaign was launched to educate the public about the glories of the NHS.
On July 5th, the new National Health Service starts, providing hospital and specialist services, medicines, drugs and appliances, care of the teeth and eyes.
Bevan believed the doctors' resistance would crack if they faced a groundswell of public demand. His trump card was the unique selling point of the NHS. Everything would cost nothing.
Are you sure I don't have to pay anything for all this?
Nothing. You and your family, having put yourselves on my list, get all the general practitioner services free.
You got your doctors, you got your opticians, you got your dentists. It just wasn't sort of just the doctors, you got the whole lot thrown in.
Following the first wave of publicity, over 20 million people signed up for the new service. Bevan's target was higher still, to get 90% of the public registered by July the 5th.
When you're ill, you won't have to pay for treatment.
I don't have to pay the doctor now. I'm on the panel.
Yes, that's true, but your wife and children aren't. The panel system...
The advance publicity hit home most strongly with one crucial section of the audience: women.
Suppose your wife falls ill suddenly.
For generations, they had been last in line when working-class families spent precious cash on healthcare.
Bevan spoke particularly about what he called the silent majority, that is, the women's health was very much impaired by constant child-rearing because there was no access to free contraception. And were worn out with their gynecological problems and their anemia, and there was no health care available to them.
Bevan also knew the strongest argument for the health service was that it would dramatically improve the lives of Britain's children. With child mortality still a grave concern, up to 10,000 a year dying from diphtheria alone, this was a compelling reason for signing up.
This boy is not expected to live. He was not immunized.
I remember as a child going to a children's movie morning, Saturday morning, and there was an advert which said, every 40 minutes a child dies of diphtheria.
This child need not have died.
Just the sort of thing to cheer up a child on a Saturday morning. But the object of that was not to teach you about diphtheria, but to get you down to the clinic for diphtheria immunization.
He could have been immunized and so protected against diphtheria.
You can get all of your people immunized, free, and you can wipe diphtheria, measles from the streets.
Stop this needless death.
The campaign was a masterstroke. Within 5 weeks, 75% of the British public had filled in NHS registration forms. It was an unpleasant dose of reality for the BMA. Their resistance